Welcome to Get Hooked on Wellness. I'm Rome Hooks, and I'll be your host for today's show. Today's show, the topic is going to be direct primary care, often called DPC. If you've heard the term and wondered, what does that actually mean? Or how is it different from a regular doctor's office? Well, you're in the right place. Behind the scenes, I also serve as the office manager of Hooked on Wellness Consulting. I direct primary care and wellness clinic. So I'll explain DPC from a practical, day to day operations and general information standpoint. I'll focus on what people usually want to know before they join a membership practice, like how access works, what questions to ask, and what to expect. And joining me is our clinical expert and co host, Dr. Alexandria Hooks. Dr. Hooks is the owner of Hooked on Wellness Consulting, and she'll answer the medical and clinical education questions today in a clear, evidence based way.
My name is Dr. Alexandria Hooks. I'm a doctor of nursing practice and family nurse practitioner, and I'm so glad to be here and glad you're here. Our goal today is to give clear general education about direct primary care so you can better understand your options for primary care and make informed decisions for yourself and for your family.
I must make this disclaimer: this program is for general education purposes only. It is not medical advice and it is not a substitute for care from your healthcare provider. If you have symptoms that feel urgent or life threatening, please call 911 or go to the nearest emergency room.
This interview is not for selling anything. We're not trying to solicit anything in any way. It's just strictly education.
Exactly.
What is DPC?
Right. Direct primary care, or DPC, is a membership based way of accessing primary care instead of billing your insurance for every visit. You pay a reoccurring fee directly to the practice itself. That membership typically covers a defined set of primary care services and access, but what's included can vary clinic by clinic. The key is transparency. You should be able to see what it is that you're going to be paying for, including your services, and what's not. And how after the after hour access may be will also be explained.
And also, from a clinical education standpoint, a DPC is often described as a model designed to improve access and continuity with the primary care clinician. Many patients are looking more for longer time with their provider, easier access, and to have a clearer relationship with their primary care provider and team.
Is direct primary care membership the same as health insurance?
This is one of the most important clarifications we can make today. A direct primary care membership is not health insurance. A DPC membership is a subscription style payment to a primary care practice for primary care access. Health insurance is a separate product altogether that helps cover a broad range of medical costs, especially expensive events like hospitalizations, surgeries, emergency care, and specialist care. So if you hear membership and think insurance, it's understandable, but they are not the same thing. A DPC clinic should be very clear about what the membership includes and what it does not include.
Exactly. From a medical education standpoint, it helps to think of a DPC as a way to access primary care in a more direct relationship centered model. It does not replace healthcare coverage for emergencies or major medical events.
Who uses direct primary care? People without insurance or people with insurance?
Actually, both. You'll see some uninsured people use DPC, and you'll also see many insured people use DPC. Here's why: uninsured people may choose it. They want predictable, transparent primary care costs and easier access to a clinician without having to worry about a separate bill for every visit. And here's why insured people may choose it. Even with insurance, people can still face high deductibles, limited appointment availability, short visit times, and confusing billing. Some insured patients use DPCs for day to day primary care access and keep their insurance for big, unexpected costs like hospital care, imaging, or specialty treatment. The important point is the DPC can be one part of someone's healthcare plan, but it's not the same as insurance.
And clinically, primary care is where prevention, early evaluation, and chronic disease management often happen. When access is easier and visits are not rushed, it can support better education, follow up, and continuity. But every person's situation is different, and it's important to choose a setup that fits your health needs and your budget.
Is DPC the same thing as concierge medicine?
They are related, but not always the same. Both are membership based, but concierge practices, they sometimes still bill insurance on top of the membership fee, while many DPC practices don't. The best move is to ask directly. Do you bill insurance? What does a membership cover? What happens if I need labs, imaging, or a specialist?
Exactly. And clinically, the model matters less than the clarity and the quality of care. The practical difference is often how the practice is funded and how that affects time, access, and panel size, meaning the number of patients the provider sees. The important part is understanding what you're paying for and what outcomes you should reasonably expect.
What kinds of things are usually included in a DPC membership?
Common inclusions can be primary care visits, longer appointment times, and easier communication like secure messaging or phone calls. Some practices include certain basic labs or procedures, and others offer those at transparent, discounted cash prices. But there's no single universal package, so you always want the membership details in writing.
Right. And from a health education perspective, what matters is that the primary care coverage covers prevention, chronic disease management, and early evaluation of new symptoms. I can't express that enough. When patients can access primary care more easily, it may support earlier conversations and better follow through.
What's not included, and what would I still pay for?
Typically, it's going to be hospital care, emergency room visits, surgeries, specialist visits, and advanced imaging. They're not included in a DPC membership. Many clinics can help coordinate those types of services, but you'd usually pay for them yourself, separately through insurance or cash pricing. Again, the details depend on the practice, so it's always important to get those answers before you decide to get into a membership.
And if I could say medically, it's important to know the limits. If you have chest pain or signs of a stroke, severe shortness of breath, or anything that feels like an emergency, you should seek emergency care immediately. Do not go to your DPC.
How fast can I get an apartment with a DPC membership?
One of the common goals in DPC is improved access, which can mean shorter wait times and more flexibility. Some practices offer same day or next day visits more often than the traditional models, but it varies, of course. Ask about typical scheduling timelines, after hour policies, and how urgent issues are handled.
Access, I'd have to say, is a big part of continuity. When patients can be seen sooner, it can support earlier evaluation and reduce delays in care. Though obstacles depend on many factors. At our clinic, for example, that's same day or next day access.
Can DPC be done through telemedicine?
Yes, many DPC practices use telemedicine as part of access, especially for follow ups or straightforward concerns. Some are even telemedicine first, but you should ask what's appropriate for telemedicine and when you need to be seen in person.
That's a really good question. Telemedicine can be a helpful tool, especially for follow up care and certain symptom discussions. It's still important to use the right setting for the right clinical situation because some situations are not appropriate for a telemedicine visit and you really should be seen in person.
Very true.
Is DPC only for healthy people, or can it help if I have chronic conditions?
DPC can be used by people across the health spectrum, but you should ask how the practice supports chronic conditions, what follow ups look like, and how they coordinate with specialists when needed.
Primary care is central to the chronic condition or chronic disease management. The potential advantage of a DPC is more time and access for education, monitoring, and follow up. But it's still important for patients to understand what services are included and what requires outside care. But I'd say the most valuable thing is having longer visit time with your provider.
What are the benefits of a direct primary care practice?
Well, let's break this down in a really practical way. Benefits can vary by clinic, but here are the most common advantages. Whenever they're looking for a DPC, they should look for certain things like more access and less waiting. Many DPC practices aim for shorter wait times for appointments and more flexible scheduling. People often want to be seen sooner when something comes up instead of waiting weeks. So, more time during visits. In many traditional settings, visits can feel rushed. Well, DPC is often designed to allow longer conversations, which can be especially helpful when you're dealing with, multiple concerns. More transparent pricing is also good for primary care, and instead of a separate bill for every visit, many DPC practices use a predictable membership fee. That doesn't mean everything is free, but it can reduce surprise billing for routine primary care. A clearer relationship with your primary care clinician. People often use or choose DPCs because they want continuity. They want a clinician who knows their history and can follow their progress over time. Easier communication between visits. Many DPC practices offer secure messaging, phone calls, and other ways to ask questions between appointments. That can help patients get guidance on whether something can wait, needs a visit, or needs urgent care. A stronger focus on prevention and long term health planning. Primary care isn't just for when you're sick. Many people want to help with prevention, screenings, lifestyle habits, and long term goals. Support navigating the healthcare system, even through DPCs. It doesn't include hospital care or specialist fees. Many clinics just help coordinate referrals, explain next steps, and help patients understand what to do and where to go. It can be helpful for both uninsured and insured patients for different reasons. Uninsured patients may like the predictable primary care costs and access, and insured patients may like improved access and time, especially if their insurance plan has a high deductible or limited appointment availability.
Mhm.
And I'll say it again because it matters. A DPC membership is not health insurance,
Right.
it's a way to access primary care more directly.
And from a clinical education standpoint, I'll add a few benefits that matter medically, especially for people managing ongoing health concerns, better follow up, continuity. And when patients can follow up more easily, it can support safer and monitoring and adjustments over time. That's important for chronic conditions where you're tracking symptoms, labs, and a response to a plan. More education, shared decision making, that's really important. And health decisions work best when patients understand their options. When there's more time for questions, it can improve understanding and adherence. Earlier evaluation of new symptoms. When access is easier, some patients are more likely to bring up concerns earlier. and can help catch issues sooner, though it's still important to use urgent or emergency care when appropriate. Whole person support is the scope of primary care, mind, body, and spirit. Primary care conversations about sleep, nutrition, movement, mental health. This is all important, and having time to address these areas can be a meaningful benefit for many patients. Oh, and one more reminder, if symptoms feel urgent or life threatening, a DPC is not suitable for emergency care. Please call 911 or go to the nearest emergency room.
Does DPC reduce ER visits or overall healthcare cost?
That's a common question. Some people join DPCs because they were hoping for better access, and that better access will prevent problems from escalating. But the evidence is still developing, and results can vary depending on the patient population and how the practice is set up.
That's exactly right. It's not accurate to promise that a DPC will always reduce emergency visits or total cost for every person. The research is still out. But what we can say is that a DPC is designed to improve access and continuity, and those factors can support better preventative care overall.
What should I ask before I join a DPC practice?
Great question. Here are practical things to ask. What exactly is included in the membership? Do you bill insurance at all? How do I reach the clinic after hours? How fast can I usually get an appointment? What happens if I need labs, imaging, or specialists? Are there enrollment fees? And how do cancellations work? If a clinic can't answer those clearly, that's a red flag.
Mhm. And from the medical side, you can ask how they handle preventative care, chronic disease management, medication refills, and coordination of care. Also, ask what situations are not appropriate for the DPC and require urgent or emergency care.
Thanks for joining us for Get Hooked on Wellness. We hope today helped you understand direct primary care in a more clear and more practical way.
And remember this was general education, not medical advice. Talk with your own healthcare professional about what's right for you.
It's not a substitute for professional advice or medical advice, and always consult your healthcare provider before making any kind of healthcare decision. And if you have an urgent or life threatening symptom, please call 911 and go to the nearest emergency room.
Thank you so much for joining us. Have a blessed day.